I remember in 1989, I started seeing patients for the first time, mostly focusing on women's health. And I would see these women come in that were having all of these symptoms of menopause and perimenopause and hot flashes and night sweats, and they weren't sleeping and depressed. And I kept trying to change their hormones, and I was talking to my OBGYN physician colleagues saying, what can we do with all these women that are coming in with all these problems? I got so frustrated because there really weren't any options to help women treat them with their symptoms. And so finally I said, we've got to do something. We've got to change their diet, maybe give them some vitamins, some nutrients, something to help reverse the symptoms that they were having. I started integrating diet changes and getting women off sugar and trying to balance their glucose and getting their insulin levels down and adding things like vitamin E and evening primrose oil just to knock out hot flashes and night sweats. And slowly but surely, women started changing. They started feeling better. They started wanting more. They started finding that their sex drives were improved, that their energy was improved, their sleep was better, and all of these symptoms started going away. The testing and the use of vitamins and nutrients and minerals to try to optimize somebody's symptoms and get rid of these ongoing nagging ailments that women would have was so incredible. And that was the beginning of my interest in functional medicine. And it's just grown to be so big today. Functional medicine is a wonderful thing that we have available, that we can dig a little bit deeper and find out what is imbalanced with somebody's system so that we can bring them back to where they were before. And the greatest thing that I hear from women today is that they finally got their life back. It's the most wonderful thing that any of us as healthcare providers at OnePeak Medical can hear.